Patient, Ms. Eleanor Vance, 62-year-old female. History, stage IV hormone receptor positive breast cancer, bone/liver mets, on palbociclib plus letrozole, osteoporosis, hypertension. Medications, denosumab, lisinopril, calcium/VITD supplements. Presentation, brought to ED by son, mom's confused, vomiting, and too weak to stand. Vitals, BP 78 50 seconds, HR 118, RR 28, temp 37.1 degrees Celsius, SpO2 92% Ra. Physical. Neuro, GCS 11, E3V3M5, disoriented, absent deep tendon reflexes. Cardiac, weak pulses, prolonged QT on telemetry. Renal, no edema, oliguria, 30 ml/hr. GI, abdominal distension, absent bowel sounds. Labs, stat. Corrected Ca superscript 2, 15.8 mg/dl, albumin 2.8 g/dl. Creatinine, 2.6 mg/dl, baseline 0.9. K, 3.1 milliequivalent/L, mg superscript 2, 1.5 mg/dl. BUN, 48 mg/dl. ECG, prolonged QT, flattened T waves. Diagnosis, hypercalcemia crisis in metastases-induced renal failure. Most urgent initial action. A. Administer IV calcium gluconate. B. Initiate 0.9% NaCl at 300 ml/hr. C. Give IV furosemide 40 mg. D. Obtain CT abdomen. Answer, B. Severe hypovolemia, BP 78 50 seconds, requires aggressive hydration before other interventions *. Which finding indicates neurotoxicity? A. Oliguria. B. Absent deep tendon reflexes. C. Abdominal distension. D. Prolonged QT. Answer, B. Hyporeflexia signals neuromuscular impairment from hypercalcemia. Corrected calcium formula used. A. Ca superscript 2 plus, 0.8 times albumin. B. Ca superscript 2 plus 0.8 times, 4.0, albumin. C. Ca superscript 2 times albumin. D. Ca superscript 2, 0.8 times albumin. Answer, B. Corrects for low albumin, 15.8 plus 0.8 times, 4 to 2.8, equals 16.16 mg/dl. The provider orders zoledronic acid 4 mg IV pre-infusion action. A. Hold antihypertensives. B. Verify CrCl greater than 60 ml/min. C. Administer IV potassium. D. Start cardiac monitoring. Answer, B. Bisphosphonates cause renal toxicity. CrCl 60 ml/min requires dose reduction. Most critical lab to monitor post-zoledronic acid. A. Calcium. B. Creatinine. C. Hemoglobin. D. Albumin. Answer, B. Bisphosphonates cause acute kidney injury. ECG shows flattened T waves. Priority intervention. A. IV calcium gluconate. B. IV potassium chloride. C. IV magnesium sulfate. D. Hold all fluids. Answer, B. Hypokalemia, K3.1, exacerbates cardiac effects of hypercalcemia. Which medication is contraindicated? A. Hydrochlorothiazide. B. Furosemide. C. Lisinopril. D. Ondansetron. Answer, A. Thiazides reduce calcium excretion, rightward arrow worsen HCM. Denosumab is ordered. Key teaching point. A. Take with dairy products. B. Report jaw pain or numbness. C. Double vitamin D dose. D. restrict fluids. Answer, B. Denosumab causes osteonecrosis of jaw, ONJ. Ms. Vance develops jaw pain 2 weeks later. Suspect. A. Oral mucositis. B. Osteonecrosis. C. Trigeminal neuralgia. D. Dehydration. Answer, B. Osteonecrosis of jaw, ONJ. Is a bisphosphonate/denosumab complication requiring immediate dental eval. Goal calcium correction speed. A. 0.5 mg/dl per hour. B. 1-2 mg/dl per 24 hours. C. Normalize within 2 hours. D. 4 mg/dl per 6 hours. Answer, B. Rapid correction risks arrhythmia/rebound hypocalcemia. Post-treatment, Ca superscript 2 drops to 8.2 mg/dl. Priority assessment. A. Gvosdeck/Trousseau's signs. B. Skin turgor. C. Bowel sounds. D. Capillary refill. Answer, A. Tests for hypocalcemia, overcorrection risk. Which diet instruction is correct? A. Drink 3-liter milk daily. B. Avoid calcium supplements. C. Increase cheese intake. D. Take vitamin D 5000 IU. Answer, B. Calcium/vitamin D supplements worsen HCM. Discharge teaching prioritizes reporting. A. Mild fatigue. B. New confusion or vomiting. C. Weight loss. D. Hair thinning. Answer, B. Neuro/GI symptoms signal relapse, 50% recurrence rate. Which cancer carries highest HCM risk? A. Prostate cancer. B. Metastatic breast cancer. C. Chronic lymphocytic leukemia. D. Glioblastoma. Answer, B. Breast cancer causes 50% of HCM cases. Prostate rarely does despite bone mets. Pathophysiology teaching point. A. Tumor destroys kidney tubules. B. Cancer cells break down bone, flooding blood with calcium. C. Chemotherapy blocks calcium excretion. D. Radiation increases vitamin D. Answer, B. Osteolytic metastases rightward arrow bone resorption rightward arrow Ca superscript 2 release. HCM-induced renal failure is due to A. Glomerular inflammation. B. Nephrogenic diabetes insipidus. C. Acute tubular necrosis. D. Obstructive uropathy. Answer, B. Hypercalcemia impairs renal concentrating ability rightward arrow polyuria rightward arrow dehydration. Symptom requiring immediate dialysis. A. Ca superscript 2 13.2 mg/dl. B. K 5.0 milliequivalent/L. C. Ca superscript 2 17.0 mg/dl plus anuria. D. Na 130 milliequivalent/L. Answer, C. Dialysis indicated for severe HCM with renal failure unresponsive to fluids. Patient asks, why can't I take my calcium pills? Best response. A. They cause kidney stones. B. Your cancer is pulling calcium from bones, extra calcium worsens this. C. They interact with letrozole. D. You need phosphate instead. Answer, B. Simplifies pathophysiology for adherence. Which finding indicates treatment success? A. Ca superscript 2 14.0 mg/dl. B. Ca superscript 2 10.2 mg/dl plus alertness. C. Urine output 20 ml/hr. D. +2 edema. Answer, B. Normal Ca superscript 2 plus resolved neuro symptoms equals goal.
Critical safety alerts for HCM. Number 1 trigger, breast cancer bone mets, 50% of cases. Deadly triad, Ca superscript 2 greater than 14 plus creatinine greater than 2.5 plus GCS less than 13 equals 80% mortality at 1 year. Confusion plus constipation plus polyuria equals calcium crisis. In HCM, lethargy isn't just cancer fatigue, it's neurotoxicity. Nurses save lives by catching Ca superscript 2 spikes before cardiac arrest. Risk. Action. Ca superscript 2 greater than 14 milligrams per deciliter. ICU transfer plus dialysis consult. QTC less than 300 milliseconds. Correct electrolyte stat. CR greater than 2.5 milligrams per deciliter. Reduce bisphosphonate dose. Jaw pain. Stop denosumab dental consult.
HCM emergency mnemonic, calcium crash. Cardiac monitoring, QT prolongation. Aggressive hydration, NS 300 ml/HR. Loop diuretic after hydration. Correct K/mg superscript 2. Inhibit bone resorption, zoledronic acid/denosumab. Urine output goal greater than 100 ml/HR. Mental status checks hourly. Calcium supplements stopped. Renal protection, avoid nephrotoxins. Assess for fractures. Seizure precautions. Hospice referral if advanced disease.